Good morning, I am Dr. Priyadharsini from Madurai. I am in E18 Course 3, 103 hands-on workshop. I am going to talk about what is the pre-operative requisites for Ovum pickup procedures. Ovum pickup procedure is a teamwork. We have to, before on the day of trigger itself, we have to properly plan and inform the availability of the anesthetist and embryologist. After planning and giving the trigger, and we have planned the time of OPU, the day prior, on the day of OPU, we should alert the nurse 6 hours before the procedure to check whether the ultrasound machine regarding the ultrasound machine, test tube warmer and biopsy guide, everything sterilized, every machine settings are proper and current is everything okay. And we have to ask the embryologist whether the temperature settings, incubators and all the machines are working properly or not. And even the OT technicians, whether the O2 cylinders are full, manifold cylinders are full, everything we have to check. And for regarding anesthetist, we have to inform the anesthetist and have the look at the patient to have a pre-operative anesthetic checklist and to have surgical checklist. Everything has to be checked once. And you should inform the front office also whether the financial closure has been done, consent forms are properly signed, everything. And then when you plan the pickup at 10 a.m., you should make the patient to come to the OP room at 9:45 a.m. to see whether the follicles are intact, it is not ruptured or not. And then the bladder should be made empty before entering the OPU theatre. These are the pre-operative requisites for a OPU procedure. And once you enter the OPU theatre, you see whether you just hold your breath for 1 minute and then feel any order is coming, VOC check is normal, and then see the ceiling whether any particles are there to verify the cleanliness of the theatre. This is very important. I have a practical experience that when I entered the OPU theatre, I felt the fragrance of condom. One of my nurse, instead of bringing routine Ovum pickup cover, she took that fragrance condom cover. Suddenly I realized and then changed. Without realizing, if I use that would have damaged the oocytes. So that point is very important. As I had told, when you enter the Ovum pickup theatre, you see any abnormal fragrance is there. With my nose only, my husband used to say, you are always a sniffing dog. Actually, on the day my sniffing helped me, I suddenly found out she brought that fragrance to condom for pickup. Then I realized and then I threw it away. That is a very important point. As soon as you enter your theatre, you have to sniff the theatre. Thank you.